My name is Dr. Nandisha Ramsingh. I am the Technical Officer for Diabetes attached to the Chronic Disease Unit at the Ministry of Health. And today we're just going to talk a little bit about obesity. So now, obesity in Guyana, we do know that at least 50% or at least half percentage of our population are obese. Now, a lot of persons might be wondering, what is obesity? So obesity basically, in the smallest words that we can be able to explain, it's when there is a abnormal accumulation of fat around the abdominal tissues. That's where you can be able to see it most. Now in Guyana, we have at least 41% of our male population that is obese, and about 56% of our female population that is obese. On a global scale, we have at least 800 million persons that are obese in this day and age. Guys, that's a lot, and we really need to have something done. So how can we do that? How can we start? Now, first things first, a lot of persons might think that obesity, it's only for the old people, for the adults, but this actually starts from a small age, and we really need to encourage our kids. So parents, you have a lot to do when it comes to obesity. Now guys, when it comes to the risk factors, or we can put the causes of obesity, a lot of times our body, we eat food that give us energy, and this energy is sometimes stored up. What happens is that if we eat foods that aren't good for us, and when I say aren't good for us, things like carbonated drinks, a lot of sugary foods, now these are they're stored up, and they're stored up as fat, and they become not utilized in a manner that we need them to be utilized. So hence the storage develops into fat. So what can we do? There is a lot that can be done. The Ministry of Health, we have been advocating strongly to patients, to healthcare workers, to have a talk. Sit down and just gaff with the patients. Let them know what obesity is. Let them know how they can be able to, control their diets, their different forms of lifestyle, exercise, and so forth. And maybe we can be able to take a step from there and try to save our future. Because as you know, in the future, we already have a expected number of at least $4.3 trillion being spent behind obesity, and this will cause a severe economic impact on our countries or around the world. So we're just kindly asking that you take the chance to be able to talk to anyone that we can be able. It doesn't have to be a healthcare professional that takes the time to sit down and have this talk with you. I know that there are community groups out there. You can be able to sit down and encourage the community, the men and the women, to just have simple lifestyle changes that they can be able to do to make us have a change in obesity. Now, I did mention earlier about risk factors. So these are the things you can be able to look out for. Persons who lack physical activity, they can be able to develop fat, and this can cause obesity in the long run. So we're asking persons to just, move a little, but we're just asking you guys to just be able to have at least 150 minutes in a week, 30 minutes a day workout. This would be able actually to assist in the fight against obesity. There are a lot of medication. So I know medication is very important. And a lot of times as doctors, we do prescribe medications for patients. However, we do know that the population tends sometimes to purchase medication off of the counter, or I should say over the counter. So these medications, such as steroids, they can actually be a little bit harmful when it comes to increasing the amount of body weight that we have. So we're just asking you to use these medications, as prescribed by your doctors or any other health care personnel that you would see. Another one of our risk factors that we have is that persons tend to eat unhealthy foods and drinks. And this is something that we have mentioned before. So for example, persons tend not to read the labeling on the juices or the drinks that they would usually buy. And we're just encouraging you to do so, because imagine you buy a small Cokes, and the Cokes that you're buying actually has 26 grams of sugar. So that's a lot for one person to actually intake on a daily basis. And I know we like sometimes in the hot sun, we want something cold to drink. So we're just asking persons to be mindful of what their intake is. Also, one of our other risk factors, and this has to do with chronic disease illnesses such as diabetes, hypertension. A lot of time persons are diagnosed with these conditions and they do not seek medical attention. They tend to shy away from the health system because either they're not comfortable going into a clinic or so to seek those advice or to seek medication or any consultation. But we're actually advocating and advising that these patients actually follow up, because one of the major parts of their treatment is lifestyle changes. And almost 62% of the deaths globally are NCD or non-communicable diseases such as diabetes and hypertension related deaths. And a major part of these are the diets that patients would have had and not upkept. So we're strongly advocating that these are some of the risk factors and to seek any medical attention that you may need. Reach out to the chronic disease unit if you need to, your nearest health center. These are places that you can be able to seek guidance, information, and any other relative issues that you may have. You can be able to talk to us. Don't be afraid. Obesity is what we need to get rid of. We need to break it down, guys. So reach out to us.
Mom, why am I fat?
One in 3 children in the Caribbean is overweight or obese. 41 million children under 5 years, 340 million children between the ages of 5 and 19 were overweight or obese in 2016. They are more likely to become obese adults, have an increased risk of early onset diabetes, heart disease, breast, and colon cancers. Obesity is preventable. Make healthier food choices and engage in regular physical activity to reduce childhood obesity. A message from the Ministry of Health, Chronic Disease Unit.
Today we have Delisa, and we'll be calculating her BMI, or body mass index. So first we'll ask Delisa to remove her shoes, and we're going to measure her height using the stadiometer. So she will remove her shoes. If she has any weighty things in her pocket, like her phone, her keys, we ask him to remove. And then we'll ask Shondell to position Delisa properly on the stadiometer so that we can take her height. We need to record her height in meters and her weight in kg, in kilograms. Go ahead, Shondell. She takes her height, she records it. And then we'll ask Delisa now to step over to the scale where we can take her weight. And the scale records the weight in kilograms. And after we have those two sets of information, we'll now go to the counselor and she will calculate her BMI using her height and her weight. And then she'll be counseled based on what range she's between. Now the BMI chart it's color coded. And the blue section indicates that the person is underweight. The green section indicates that they're a healthy weight. The yellow indicates that they're overweight. And the pink, obese, and the red, extremely obese. For our activity today, we have some food items that are prepared using food models for our demonstration. And we have here the demonstration of a healthy plate. And if you notice, it has 4 sections. And we recommend that half of your plate be fruits and vegetables. And here we have the broccoli with an apple. We have some fish fingers, which is the protein, which is should be quarter of your plate. And we have the staples, which is 2 pancakes. And over here we have a healthy lunch. As you can see, we have the okra and the fruit, plus we have the chicken and the peas and beans and the rice. And if you notice, for both plates, half of the plate is fruits and vegetables, quarter is your protein, and the other quarter of the plate should have your staples. We recommend drinking a lot of water too. If you can use water with every meal, we would recommend that. But for the entire day, it is recommended that you use 8 8-ounce glasses, which is equivalent to 4 of these 500 ml bottles of water. So during the course of the day, we ask that you try to consume at least 4 bottles of the 5 ml water. Out here, we have some other food models, and we have them according to the food group. We have fruits over here, some fruits. Here we have items from the staple food group, food from animals, and over here we have the items that you should use in moderation. We're not saying that you should eliminate them from your diet completely, but do not use them too often. All of the cheesecakes and the donuts and all of the sweet and sugary items. We ask person to reduce their intake of sugar because sugar is what we call empty calories. It has nothing, no other nutrients in it, but it just provides you with calories. And if a person is using too much sugar, you find it will cause you to gain weight, especially if it is not being burnt up. So we ask that you consume a healthy diet and stay away from the sugary foods. Another thing we recommend is that you stay away from the sweetened beverages, or what we call the sweet drinks or the aerated drinks. That's because these two are loaded with sugar, lots of sugar. So we ask that you do not give it to your children. We prefer that you make your fruit juice. You buy your fruits and you make your fruit juice, and you can use the sweet fruit, the pineapples and the bananas and so on, to make smoothies where you do not have to add much sugar, because these two are very high in sugar and provide the body with a lot of calories. So we recommend that you eat a balanced diet every day, half of your plate fruits and vegetables, quarter for your staples, and the other quarter for your protein foods.
There are 9 food-based dietary guidelines in Guyana for you to follow and live a healthy life. Guidelines 5 and 6 deals with sugar and salt consumption. An important step we can take to watch our sugar and salt consumption is to read food labels. This is very important as there are a lot of sugars and salt in many of the foods we eat and drink. So when we are reading the labels, we need to look, for instance, at the sugar content and the amount stated, and multiply that by the servings per container to know the total sugar in the product. Or we look at the salt or sodium content and the amount stated and multiply that by the servings per container to know the total salt in the product. The daily recommended amount of added sugar for males and females should be 6 teaspoons or less, and the daily recommended amount of salt should be less than 1 teaspoon. For instance, the amount of sugar in this size of soft drink could be as much as 16 teaspoons, and in this kind of drink as much as 10 teaspoons. Please, let's pay attention to what we are eating, as overconsumption of unhealthy foods leads to many illnesses, including high blood pressure, obesity, and heart disease. Come on, Guyana, let's use the food-based dietary guidelines to reach for a better life with good health.
Ms. Trim, can we talk a little bit about the food-based dietary guidelines for Guyana? We can touch a bit on that now.
Yes. Now, these guidelines were developed by the Ministry of Health and also FAO. And they were designed based on our context and our culture here. And if you notice, for the food-based dietary guidelines, we use the stew pot as the logo, or the cannery. And that's because everybody's familiar with the cannery. And we use that to show the 6 food groups. Now, before, in 2005, we had launched the guidelines, but there were only 7 guidelines. And they made some adjustments and added, especially breastfeeding. So now we have 9 guidelines, and these are designed to help persons to prevent nutritional deficiencies, to help to maintain a healthy weight, so that we don't have persons who are overeating and becoming obese. So it helps you to maintain a healthy lifestyle. And it also, one of the guidelines also includes exercise, right? Because diet and exercise will help you to maintain a healthy lifestyle. And if I'm to go through the guidelines with you, the first guideline says that you must breastfeed exclusively for the first 6 months. And that's one of the things that we promote at the food policy. We promote exclusive breastfeeding, which is breast milk alone, from birth to 6 months. I know some persons may feel, oh, that is not enough for the baby, but that is a balanced diet and has everything. The best gift of love that a mother can give to her child is to breastfeed. And that's why breastfeeding is guideline number 1, because breast milk is the first food. So that's the first guideline. And if we were to look at the second guideline, it says eat different types of food from all the food groups daily. And there's a picture of the cannery that is on the pitch. Oh, it's on the food-based dietary guidelines, and it shows the 6 food groups where you have your staples, you have your legumes, your food from animals, your fats and oils, your fruits, and your vegetables. So we have to ensure that we eat from all of those food groups daily, because each group provides its own set of nutrients. And if we eliminate maybe a group or two, we could find ourselves running into deficiency. That's if it goes on for a lengthy period of time. The next guideline says eat more green and other colored vegetables daily. And we know the colored vegetables are rich in vitamin A, they're rich in antioxidants, and rich in all of the vitamins and the minerals. So we encourage persons to eat every day the colored fruits and vegetables. Then guideline number 4 says eat different kinds of fruits daily. And one of the things I love about Guyana, when you go into our market, you see a wide variety of fruits. So even though it may be a bit expensive, but we have the fruits that are available to us. And guideline number 5 said limit the use of sugary foods and sweetened drinks. And I touched on that earlier. Asking persons, instead of choosing the fizzy drinks or the aerated drinks or the drinks that have a lot of sugar, and we need to encourage persons to start reading labels, look for the sugar content, because sometimes just one beverage will have almost the total amount of sugar that we're allowed for the entire day. So if you use that one beverage, you don't have maybe just 2 or 3 more tablespoons that you can consume, right? And if you choose to have 2 of those, you're gone beyond the required amount of sugar for the day. So try to avoid the sugary drinks and the sweetened beverages, and also the salty snacks. And guideline number 6 says use more natural seasoning and less salty products. And we have lots of natural seasonings here. We encourage persons to season your pot with the natural herbs and spices. We have our shallot, our onion, garlic, thyme, ginger, all of those things that are available at the market. So use that to flavor your pot instead of the aji or the monosodium glutamate, as we call it, and the cubes and lots of salt. Use that and we get all of the benefits from the herbs and the spices.
This is a good tip for food preparation for those persons who plan not to purchase food on the road, but probably prepare their own, their own pots and so forth.
Because when you prepare your meals, you know exactly what's going into your meal, because you know what you are putting into the meal. But when you buy food, let's say from a street vendor or anywhere else, you're not sure. Right, it may taste good because they have added all of the flavor enhancing herbs and spices or aji and cube and so on. So we have to be very careful in terms when we choose to purchase on the road. The next guideline says use natural seasonings. No, we did that already. Next guideline number 7 says reduce your intake of oily and fatty foods. While our body needs fat, because fat is essential, because we have fat-soluble vitamins that require fat for digestion. Fat is required to insulate our organs and so on. The problem comes when we use too much fat. So we have to ensure that we use fat in moderation. And there are certain guidelines that we can use. We have the hand jive that can give you a measurement as to how much fat you need to put in your cooking when you're preparing your meals. So try to avoid the fatty foods and the oily foods. And guideline number 8 says, if you drink alcohol, do so in moderation. And this guideline usually always causes a discussion, sometimes heated and sometimes lengthy discussions.
Indeed.
Because persons may say, what's moderation for you may not be moderation for me. And we always preach moderation when it comes to alcohol, because we know of the ill effects of alcohol, and we know of if a person is alcoholic and they consume too much alcohol, we know that the risk factors in terms of the chronic diseases that they're setting themselves up for. And we usually recommend in the food policy 1 drink a day, 1 shot a day. I know a lot of eyebrows are being raised out there, but we always say moderation when it comes to alcohol. Don't overdo it, because it has a negative effect on the body. And the last guideline says use at least 30 minutes of exercise daily. That's physical activity. So, and we touched earlier on the importance of physical activity in terms of diet and exercise. The two go hand in hand. And exercise has a lot of benefits, so many benefits in terms of relieving stress, in terms of our bodies working better. It improves your heart rate, it strengthens your heart, increases your circulation. And you know, once your circulation is increased, all of the functions of the blood are optimized. So the blood takes oxygen faster to all of our organs. It clears away waste faster, and it also takes nutrients to the organs. So we have to ensure that every day we exercise for at least 30 minutes. And I'm not sending persons to go and buy weights and buy your mat and buy all these fancy outfits. Just ensure that you have a comfortable shoes and you can do brisk walking around your neighborhood. You can use your stairs, go up and down on your stairs, but just ensure that it is brisk and you raise your heart rate and you sweat a little. Every day, just 30 minutes we recommend. If you can do more, do more.
Definitely. Thank you so much, Ms. Trim, for joining me on the program.